I'm Jim D'Antona, CEO of the San Luis Obispo Chamber of Commerce, and I'd like to thank you all for joining us today for our weekly free webinar series. We started these webinars during the crisis to provide our community with the most credible and up-to-date information and resources. While we are a membership organization, we have opened these webinars to the public because we know how important connecting you to information and resources are at this time. Our mission is making sure our community, our county, our region has a healthy business economy. If you'd like to be notified when we launch these webinars, please reach out to us to be added to our email list, where we will also send out important updates and information as it becomes available. Today's discussion is once again an incredibly important conversation as we dive into the topic of our county's reopening. Let me start with one point that I think is incredibly important. I am truly thankful to the county personnel for starting this discussion early, so that folks have a chance to read, understand, and ask questions. It has shown incredible foresight to proactively begin these conversations before the state potentially transfers jurisdiction over these decisions to the county, rather than having to react in the midst of the change. I have worked for many years in government, and I can tell you that it is indeed a rare occurrence to see governmental bodies acting in a proactive way. We are lucky to be served by this county and our local governments who have worked together on this plan. With that said, we have all seen some of the confusion that exists in the community. And so our webinar today is put on to try and tackle some of these questions so that we can move forward with some clearer ideas of what's happening. I don't think the confusion comes from a place of malice or an intent to ignore the law. I believe it comes from a lack of clear understanding of the different levels of control and authority. So that's why today we have asked Guy Savage, Assistant County Administrative Officer, and Derek Johnson, the City Manager of the City of San Luis Obispo, to join us today to talk about the reopening and how all of this relates to the governor and the state's orders. With all this talk of phases and stages, modified reopening, partial reopening, and expansive documents, we know it could be hard to understand what you should be doing now, let alone what you should be planning for in the next few weeks and months. I want to thank you both for joining me today. And before we jump in, I want to do a little housekeeping for our guests. We'll be taking questions after both of the presentations. So if you have a question, feel free to click the Q&A button at the bottom of your screen and ask your questions. Please do not use the chat feature. If we have links to share with the group, it will go out in chat. I will work through as many of the questions as I can at the end of the presentations. Please know that we do have staff answering some of the questions in a written format directly in the Q&A, so please watch for a written answer to your questions too. So with that, let's jump into today's discussion. Guy, thanks for being here, and can you give us a little rundown of what the reopening start guide is?
Yeah, thank you, Jim. Hi, everybody. Guy Savage with the County of San Luis Obispo. I'm going to spend a few minutes talking about the start guide. Of course, I would be remiss if I didn't start off by talking about all the people that helped build the start guide. Importantly, we had an expert panel that consisted of 3 doctors, Dr. Nazmi, Dr. Ferguson, and Dr. Ritter, epidemiologist Ann McDowell, and a local lawyer, Kathy Upright, who served as our expert panel. In addition, we had a key project team. It included Derek and myself, as well as a number of county employees, plus 2 members of the REACH team, Andrew Hackelman and Melissa James. In addition to that, we had an expert panel, or an elected panel rather, that consisted of 2 board members, Bruce Gibson and Lynn Compton, and 2 local mayors, Heather Moreno and Karen Ray Russell. In addition to that, we had over 250 representatives from local communities, industries, and business sectors provide us input as we developed this 63-page start guide. As I think it is appropriate at this time, the start guide is available on readyslo.org. For those who haven't, for some reason, already downloaded your copy, it's available in Spanish, should you wish to see a Spanish version. And importantly, on readyslo.org, there's a space for you to provide your feedback. The feedback that we're receiving is incredibly important to the next step of the start guide. We're at about version 1.0, 1.1, so early kind of beta version of the start guide. Being an old software guy, I often think in terms of releases of software. This, of course, is a document, but we're in the early phases of that. So feedback from you and the community, as well as other experts, is critically important to making the document even better. One of the things that's been lost on some people is they don't get past the first 20 or 25 pages of kind of the technical details about how we will move forward from an epidemiological and medical perspective and all the science and data that will allow us to move from our phase 1 into our phase 2 and so on. And they often miss the standards and guidelines, the nearly 20 pages of standards and guidelines that are kind of in the middle of the document. Those sections of the document provide unique and specific industry or general office information for the kinds of things that you can do today to begin to prepare your business for opening when the time comes. So back for a minute to the input we've received thus far. We have received over 900 comments. We're in the process of reading each and every one of those. In most cases, we're providing a direct response to the respondent, but we're also sorting and categorizing and cataloging those comments to see how we can better improve the START guide moving forward. You know, I talked a minute ago about we're at kind of version 1.0 of the START guide, and we're clearly right now working on what I often refer to as version 1.5, which is really just those corrections of critical errors, making sure that things in one section match another section, preparing for future releases. Sometime in the near future, I anticipate we'll announce a START guide version 2.0, and that's maybe one of the ones that some of you are really looking forward to, because in that version, we'll do away with, I believe, our 3 phases that we've been talking about now for a couple of weeks, and instead shift to a full alignment with where the state's at and the 4 stages that the governor of California has been talking about. We're hoping that that will avoid and eliminate some of the confusion we've seen thus far between our phases and the governor's stages. But while we do that, we continue to work on the existing document to be able to provide the most up-to-date and clear information that is needed by businesses that are looking to reopen. We all heard, I think, today on the governor's call quite a bit about where he's at with his efforts as he releases the entire state into the early phases of what he calls stage 2, meaning retail businesses will be able to provide curbside service, and some of the manufacturing and logistics that support retail businesses will also expand their operations. You know, there's a lot of discussion, he talked about it again today, about how certain communities may be able to proceed further into phase 2 and begin offering things like seating at restaurants, opening of more business and office spaces, and what was in our phase 3, malls. So we'll see how that comes about over the coming days and weeks in our community. I know that enforcement's often a question, and we can talk a little bit about enforcement. Again, if you were listening to the governor today, you probably heard that he sent ATF officers out to talk to about 80 businesses in other communities that were operating outside of his guidelines. I think it's important for us to take a moment to note that the county has always said we will align with what the governor says, and that we will support where the governor's trying to go from a phased reopening perspective. Early on, a couple of weeks ago, when we first started working on the START guide, there was no guidance, so it made sense for us to kind of forge ahead on our own as we felt appropriate. Now that we're seeing where the governor wants to go, we'll be working to align with the governor and where he's headed. I hope that we can move more into phase 2 here very soon, and we're working with the governor and his staff to figure out what that would take for our communities. You know, I think there's some critical differences between what the governor has said and what we've said with our document. And, you know, I think there's a lot of disappointment from many. Our phase 1 included full opening of restaurants, places of worship, hair salons, and gyms being opened in a limited capacity. Whereas the governor says, you know, those are more phase later, not for days, weeks, or maybe even months before we could do those activities. So we'll be working to try and reconcile the differences between what we've been saying and trying to do and what the governor's doing. I talked a little bit about the governor's stages and our phases. I want to be really clear that an early stage 2 opening, and I know you've heard this before, but an early stage 2 opening does not mean we'll be moving into our phase 1 of START guide. Instead, it means just what the governor has said. Some local businesses, retailers in particular, could begin officially offering curbside pickup and those sorts of operations. We don't have a whole lot of the manufacturing or logistics that I believe he's referring to in our community, but where we do have it, those businesses will begin to operate as well. While we wait more from the state on its plan, we're continuing to look, like I said, at our plans. We're continuing with what I've been, again, describing as phase 2, to look at what other sectors and businesses could we include specific guidance and all of those best practices to help you open in an efficient manner, and how we make that work moving forward. At the state level, we're continuing to advocate and plan for more local control, with the hope and expectation that the governor will allow us to do more of the activities that we've outlined in our plan. But of course, again, it would be in alignment with the state's plan. And then last but certainly not least, if you go through the first 20, 30 pages of the START guide, it talks a lot about different mechanisms and things that will help us either move forward or roll back our reopening of our businesses. Key to that is expanded testing. And I think many of you have heard, but we've partnered with the state testing service from Optum. We're now offering 2 sites, one at the Ramona Gardens Community Center in Grover, and the Vets Hall in Paso Robles on weekdays, 7 a.m. to 7 p.m. And so by appointment, you can get tested for COVID-19. So with that, Jim, I think I'll stop and I'll turn it back to you and we'll go from there. Thank you.
Thanks, Guy. I really appreciate kind of that breakdown and getting us started down this discussion. I would ask one question before we jump over to Derek, and that would be, is there currently a conversation, I think you talked about some of the state work, that is happening between the governor and the counties, or is this all being done completely separate?
So let me play that back to you and make sure I answer the correct question. We are in communication with the state, if that's the question, on what we're doing. It feels to those of us who work so hard on this document, including all those folks I mentioned earlier, that it feels a little bit like the state's copying what we already did, which we're happy to see. It seems as though we've set a good path, and the governor and the state folks are taking advantage of the path we've blazed. We are in daily, regular communication, particularly with the health officers at the state level, as well as Dr. Borenstein. So we are working with them to try and sort those differences out.
Excellent. Yeah, that was the question I was going to, because, I think some of the conversation that we hear out there is just that, are these things happening in a vacuum? And knowing that the county of SLO is talking with health officials at the state, they know kind of what we're doing. You're not just blindsiding the governor with a lot of this stuff. I think there's good conversation. So I'm sure there'll be plenty of questions to revert back to that. So Guy, thank you so much for joining us today. I'd like to bring in here Derek Johnson, the city manager of San Luis Obispo, talk a little bit, hopefully, about, from a city side, what does he see? And if possible, I don't know if these conversations are happening. I know you're specific to the city of SLO and can't speak for other jurisdictions, but I'm sure we have folks on here today. If any of the city managers are talking about what this means locally.
Yeah, well, thank you, Jim. I know for many people on today's Zoom call, this is probably your fifth, sixth Zoom call for today. So I just appreciate over nearly 250 people participating today. That's really great to see everyone interested in this topic. And I know it can be frustrating. I recognize it can be confusing. I think, I appreciate Jim's comments at the outset that, we're fortunate to have a regional government like the county and supporting cities that are very proactive. So I would say, the START guide represents our region's best thinking to try to figure out what is right for our region and the best approach to address the pandemic. And so we are fortunate to have Cal Poly and some local physicians and business leaders that participated in the development of that plan. And we knew there was a little bit of a risk. We knew there was some risk in developing this while the state was doing its work. Literally, as we were drafting it in real time, the governor was releasing his guidance. The president was releasing his guidance. And so the medical team and all of us had, I think, a hell of a time trying to keep track and sorting through all of those deals and reconciling that. And then, of course, as Guy pointed out, then the county and Dr. Borenstein released the START guide on May 1st. And then subsequently, there's been additional information seemingly every day from the governor at the press conference. And so it's great to hear from Guy and the county. And I think the county's been clear all along that this is intended to be an adaptive plan and one that will adapt to the changing environment. And I know that that is difficult for business. I mean, business thrives on consistency and predictability. And I think that's been the hardest part of this emergency, is that we don't have that predictability and consistency. And we are doing our best, and we are trying to find ways to simplify it. At the end of the day, it is a complicated public health issue that has to do with a variety of factors. And we are trying to make it as digestible as possible, with things for businesses to say, what do I need to do and how do I need to do it? Because we know that our businesses want to do the right thing. They're just looking for us for leadership and guidance. And we're, frankly, to be honest, we're struggling just giving the conflicting and the information that's coming down from the state. So you have, I think, I can't speak for Guy, but I see him nodding his head. I think you have our promise that we're aligned to try to make that happen. So I do have a presentation that's keyed up for today, maybe to relieve everyone from looking at a screen of Brady Bunch boxes, and I can walk you through with hopefully some infographics that will be memorable for you as you walk away and think about ultimately what is going to be the City of SLO's approach. So with some patience, I'm sharing my screen, and I think hopefully you're seeing that. All right. So just to jump down, I think, as I mentioned before, this is a dynamic and unpredictable conditions. We believe that we've probably heard most of what we're going to hear from the federal government in terms of federal guidance. As you can see, just up until really game time, 2 o'clock today, we were just processing information that was coming out of today's governor's press conference. And so with new information about testing and tracing and tracking and the number of cases, as Guy mentioned, the START plan is our first, we released the first one last Friday, and it is an adaptive plan, and we are, I'm really excited to see that we'll see other versions coming out. I think as Guy mentioned, we've had over 900 comments on the plan thus far. And so it'll be an adaptive plan, and we're going to try to refine it in a way that's easy and digestible and useful for the business community. So let me talk a little bit about the city's role, because I think there is a little bit of confusion. This goes back to, my 10th grade civics day, about the roles of government. And, one thing for people to remember is that, counties are political subdivisions of the state of California. So they carry out many of the public health, mental health services for the state. And so in this instance, in this disaster, essentially Penny and Wade are leading the way. And so this is, their orders are really our orders. And so we take guidance and instruction from them. So our role is to support and collaborate with them, and then in turn make sure that we're really paying attention to the fine-tuned details of what, in this instance, our business community needs to get back in business and get going and comply with the applicable rules and regulations. So that role is compliance with the county's shelter-at-home order for issues within the city. We look to the county to cooperate with them under their direction. We have taken a compliance, not citation-driven approach. And fortunately, we've had just fantastic cooperation from the business community. We've done dozens of business contacts, and I think 99% of our business contacts, and when people phone in to our line, which I'll give it in just a minute, and ask questions, people are just confused and they want to do the right thing. And with a short conversation, we get them headed in the right direction. So preparing for the phases moving forward, what are we doing? We will, of course, continue to prioritize health and safety. And I can't overemphasize that how much it is important the time we're in right now. We have made such significant sacrifices for our community. We've made financial sacrifices for all of you, for your businesses. And so now we need to hold strong and continue to adhere to the measures which are really designed to make sure we're capitalizing on all the progress that we've made. We will be continuing to review the county START guide, and we'll base our plans and actions and helping you get your business off the ground based upon what requirements come out from the county and the state of California. I would strongly encourage all of the businesses, and you got some hints from that from the governor and also from in the START plan, to start preparing and securing the PPE that you need to reopen. I think you've all heard about the PPE shortages for first responders and the medical industry. So one of my biggest pieces of advice is, how do you start thinking about securing that PPE? And then also be thoughtful about reconfiguring your office space, your signage, other details. And the better prepared you are to open, even if it's at limited capacity, we believe the more successful you'll be. Tomorrow, we're convening our disaster council to take some actions to help with economic development and recovery. So we're going to be relaxing our enforcement on signs, on parking requirements, and in other areas to really help businesses be able to use right away in other areas to really create the physical distancing that you need. And if you have questions about that, I'd love to entertain those on the Q&A portion of today's presentation. Compliance during phasing, how are we going to approach this? Really, it's about education first. We want to approach it to making sure people get accurate and timely information, and we're doing our best to try to sort through all of those funnels of information and try to distill it down to something that's actionable, because ultimately that's what business want. We have thus far issued 0 citations for businesses in violation of the shelter-at-home orders. We've gotten that compliance largely just through conversation. And then we suggest that people continue to use our city and business resident hotline so you understand the parameters of the phases, and so that we can get you timely information. And we think all of that ultimately will result in better public health outcomes. So what are some resources for you and the business community that you should be taking advantage of? The county set up a phone assistance center. They have a virtual assistance center at readyslo.org. The city, for city businesses, we have a business and community hotline. Many of you may have heard that we were fortunate to bring Lee Johnson back to the city, and he's serving in a role of training business ambassadors to be there to support business as they reopen. And so we're working with Lee, and we'll be working with the team there again, so we get timely and quick information back to businesses. And we've set up a website at the city website where you can find information to all sorts of variety of resources to help businesses get back on their feet. So I just want to close, with some words of optimism and hope. We have seen tremendous amount of, compassion, resiliency through this. I know we are strong. We're San Luis Obispo, and we're going to need your support in moving through this crisis. And we're here to help you and serve the business community at this time of important business transition. So thanks, Jim.
Thanks, Derek, for that. Appreciate you kind of bringing that full presentation to talk about, because what you talked about was exactly right. The Civics 101 lesson, and we're all learning it in things we may have not or may have forgotten back in 5th grade. And, trying to get back to those points of who controls at what levels and who has what authority. And I think, first of all, I would say thank you to the city. When this crisis first came up and we ordered the shelter in place, the county and the city worked together immediately to try to help people determine what was an essential business. So we've seen from our perspective how active the city has been to try and help in this situation. I think you know, I know it's tough for our business owners. I hear from them all the time, but I also see how tough it is on government who's trying to operate in a brand new scenario to try. So I'm certainly thankful for all the work you're doing there. And on behalf of the City Council, making sure that our business owners are prioritized in a health manner. Because again, our position from the Chamber is a healthy economy requires a healthy community. So these are things that are definitely intertwined. So we'll jump into some of the questions here. Guy, I'll start with you, and it's, I know your staff actually already answered it in the writtens, but I think it's really kind of one of those key questions that keeps coming up. And so just to make sure people see it, I just kind of want to be available. There are specifics being drafted for restaurant opening rules, both at, I know the SLO County is doing it, and we heard today that the governor's doing it. Do we have timelines when those will be available? I think I know the answer to that one. But more, if they conflict, whose would supersede? And is there a time when the state transfers that over to the county, or is it always at the state level?
The favorite saying, right, when you're on a call like this, Guy, you're muted. Yeah, so as the answer said there, you know, the county is a legal subdivision of the state. So clearly where the state maintains control and exercises its control, it sets rules and the county supports and follows those. Now, where the state either leaves us latitude to define rules that work for ourselves in a better, more appropriate fashion, or they provide no rules, certainly our rules will be applied. I think importantly, and this was part of the answer, what we put out thus far, don't view them as rules. They are a set of best practices. They're standards and guidelines that set up the best situation for your business from a health and safety perspective. So following them or not following them isn't against the law. Instead, it's just what you really should be looking at, what you really should be considering, and what you should be doing in your business to keep your employees, yourself, and your customers safe.
And I think that what you said right there at the end was a really important question or comment. And I think it's something that's had to I've had conversations, we'll call them conversations, with people about, you know, complaints versus citations. Why isn't the county citing specific to this? And now that there are these best practices, are they citations, or is it really about creating the best practices for people?
Yeah, I would change that ever so slightly and say it's really about keeping ourselves and our fellow citizens in our community safe. It's really about that. Dr. Bornstein is making decisions that are data-driven, science-driven, in an effort to keep us safe.
Yes, a great point. I appreciate that. So we'll dive into this question. I know this is crystal ball. I think I know the answer, but you know, again, in theory, any idea whether or not large conferences in SLO will be allowed in early November?
Yeah, that's very much crystal ball. I don't know that anybody can predict today what we'll be doing in November. You know, I think most of us are hoping against, but planning for a potential second wave. Some would say it might come in the late fall and into early winter. So I wouldn't want to prognosticate what's going to be happening in November, certainly at this point. But I think it does bring up an interesting question. We're also getting a lot of questions about, well, what about Memorial Day and July 4th? You know, those are even closer to us than certainly November. For the most part, I think it's safe to say that large gatherings for the 4th of July are probably not going to happen. It's unfortunate. I enjoy the fireworks show as much as the next person, but I don't see us having large gatherings for a 4th of July fireworks show, for instance.
And kind of to that point, I mean, in the current start guidelines, phase 2 only lets us get to, was it up to a maximum of 30?
50.
50. So, you know, looking at that, that's at least 30 days beyond whenever the county is given that kind of authority, right?
That's correct, yeah. Yeah, and, you know, I think this is one of those areas that in working with the state, some of that may change, may not change, but we're trying to understand and better prepare ourselves for whatever it is the state directs and allows to happen in our communities. So we'll have to watch that space really closely. I know that has been, this whole conversation around events and venues has probably been the biggest confusion as far as what we've been trying to describe with the START document. On the one hand, you can have a restaurant that has up to 10 people at a table and a couple of tables that might be that big, but you can't have a private gathering, either on public or private property, of more than 10 people. And that's the way the rules are written. It's not an attempt to pick winners or losers. It's not an attempt to stomp on people's ability to get together, but it's really driven by the health, safety, science kinds of view things. We just don't want that many people together that'd be highly interactive like you would at, say, some 25, 30, 40 person party right now.
Makes sense. And kind of working along those theories, we've heard about a sales tax holiday implemented by the governor, putting that, which has strained the resources of both your organizations, I know. And as a way to try and incentivize some ability for businesses to kind of survive. Have there been any conversations about property taxes and whether there's other temporary relief or postponement of taxes that would help?
Yeah, so happy to take that one as well. Postponement, our property taxes were due, about a month ago, right? There was no postponement on April 10th, 15th, 10th. But the county's auditor controller, treasurer tax collector, like so many other counties, have said, look, if you can demonstrate a clear problem because of COVID-19 in a one-on-one kind of basis, we'll have a conversation with you about deferring those tax due dates a little bit. And in particular, waiving any penalties or fines that might have been associated with not paying your taxes on time.
And Jim, there was some action that was taken by the governor to essentially allow for small loans to businesses for sales tax. And so the California Department of Tax and Finance has those details about how to apply for that program. So it's available essentially to businesses that I believe that have gross receipts less than 3 million, and it's up to $50,000. At least that was how the program was initially crafted. So that program has been approved. So that's something that both Guy and the city are evaluating. We think they're very helpful for businesses to give them relief, and at the same time, that's the funding that we use to pay for firemen and police. And so we're trying to figure out on the back end, what does that mean for us to make sure that we still have the critical services that we need to support the community.
Yeah, absolutely. We definitely get it on both sides of this one, understanding how this is helping our businesses definitely create a little cash flow so that they can survive through it. But it's also, we know it's taking away from the coffers that are paying for the public safety and all the programs for the city. So, we certainly appreciate how local government is taking the hit on this one to help businesses too. So it looks like, one of the ideas is a business that is not essential, that may have figured out how to space out their operations to continue to work, to provide all the guidelines. They can meet everything that's in the START guide, and they're wanting to open because they know they can do it safely and protect the community, but do not fall under the state's stage 2. They are still on hold. The county cannot make a decision, correct, to waive that?
That's correct, yeah. So that kind of takes me back to my earlier comments. We will be aligning ourselves with where the state's at, because we can't go any further into, for instance, the state's stage 3, while the state is still saying we're there in stage 2. So for instance, as I mentioned, places of worship, gyms, those sorts of hair salons, the governor says no. Therefore, the answer is no at this time. So yeah, we're essentially bound by what the governor has put in his stages.
And at some point, I know that he's talking about, today, he specifically talks about self-certification on some of those. That will eventually translate down, but only in those categories where they've kind of identified it, correct? In terms of health, if you certify for health that you meet the criteria, even if you self-certify, you still can't open unless you're in the categories that have been correct.
Yeah, right. Yeah.
Just want to make sure I'm giving that we're giving all the right information out.
Yeah.
Obtaining PPEs are going to be a key part of reopening. Is the county potentially open to bringing it all together, or are you potentially looking for groups like potentially the chamber to pull groups together in order to obtain PPEs?
Yeah, so it's really more the latter. If there are small consortiums, either via the SLO Chamber or other groups that want to come together to be able to buy in bulk, so to speak, and obtain PPE, that's what we're looking for. We are beginning already to shift away from the whole conversation around essential versus non-essential business, right? That's part of what the START guide attempted to do, was separate us from that terminology. But as it relates specifically to the PPE, yeah, the county's not in a position to procure or be an outlet for PPE for businesses, unfortunately. Interestingly, just yesterday, when we think about the county, we kind of think about it in two roles, right? There's the county operations, the things we do day in and day out, and separate that, at least in your mind, between all of the things that we're going on or that are going on out at the EOC, meaning the county's emergency response, right, related to this event. And just yesterday, we too started to shift away and are looking to our normal suppliers to provide PPE and other supplies for the county as a normal organization. So early on, because we were all responding to this pandemic, we relied on the EOC, the Emergency Operations Center, and its abilities to get PPE and other things. We're beginning to shift now, much like every other business, out into the community to our normal suppliers to find our PPE and hand sanitizer and sanitizing wipes and everything else.
Excellent. And I think it's a really interesting idea of folks maybe collaborating within their sectors to try and get volume together. Certainly makes you probably a more interesting buyer in the private sector. Looking at an interesting point, and this one I'm interested in, Derek and Guy, either of your thoughts here. Plans regarding reopening tourism. So we know hotels are open for essential work if you're having to do construction or projects and be in the hotels. Potentially, would people traveling within the county be allowed to go into hotels and tourists and go to the beach, etc.? And are we making rules about where do we draw the lines, as opposed to having people come from LA, San Francisco, the Valley? Any of those thoughts would be helpful.
Derek, you want to jump in, or I'll go?
Yeah, why don't you go in and then I'll follow up. I'll close.
Yeah, so yeah, I would say we are looking at that. We've had any number of conversations about how we treat things here within the county versus those coming from outside the county. And when we talk about the county, even the START Guides development included Santa Maria, since we share so many employees with the region that is the broader Santa Maria Valley. So when you get outside of that region where we're treating employees on a daily basis, yeah, we do need to be saying we appreciate folks coming, just not now, right? Come once we've gotten past this critical time. I was on a Zoom call earlier, and I think it was an interesting note, just because the numbers happen to match when you look at them today. When you look at Tulare, Fresno, Kern, and Santa Barbara counties, in the last 24 hours, they've reported 208 new confirmed cases. That's our total since the beginning of this thing. So those communities, Tulare, Kings, Fresno, Kern, are often visitors into our community, and they're seeing much higher rates of infection than we're seeing here locally. So again, we love our tourists. We know that our economy is built on tourism, but we just can't have them coming right now.
And I would just, just to add to that, is just say when ultimately the state allows the county to implement, elements of the START plan, ultimately the measures that are in place and the guidance that are put in place are intended to address the concerns about people coming to our community. So the physical distancing in restaurants, the ability to, or for gyms and spas, to not open, And so the different parameters under the START plan, they are specifically designed to address the fact that we are a tourism community and help stop the spread. It's not going to be perfect, but at the end of the day, our plan was designed specifically to take into account that we are a tourist destination. We've had relatively low numbers, and in fact, we could see people who come to our region and to our county that may bring it with them. And so those measures that are put in place in the START plan are designed to limit the spread.
Great. Yeah, thanks for that. And again, I know it's a controversial topic and we're looking at all those things. And, when is a person is doing essential work or when are they traveling is so difficult to parse out. So, but we understand and we appreciate that that is something that's on your minds. Mm-hmm. Another question came in. This one I'm not sure you'll be able to answer, but it's an interesting question. Has martial law ever come into play during a pandemic in the U.S.? At what point could that become a reality, or is that not conceivable? Is that a state function that would declare that, or would that be declared at a county or city level?
I'm not an expert in martial law. Derek, do you have an answer to that one?
We would look to the federal and state government if it got to a point where we were seeing activities that were really starting to compromise public health. And I can't imagine that the citizens of San Luis Obispo would let it get to that point. I imagine that thus far, as I said, we've gotten fantastic compliance and response. Is it perfect? No. Do I see things when I'm driving home from work every day, going to the market that I think is questionable? But yes, but at the end of the day, I don't know. And we can't look into each one of those particular circumstances. So I think that's highly, highly remote prospect, and I hope we'll never find ourselves there.
Great answer, yeah, to a tough question there.
Yeah, well, I might add, while we certainly have law enforcement, police and sheriff, police and the city sheriff in the unincorporated area, we don't have a SLO County National Guard. We don't have a SLO County Army. So martial law would have to be implemented by somebody with that sort of a resource that we simply don't have.
Excellent. On many levels, excellent. Yeah. What I would say, so even before kind of the shelter in place order, wine tastings and our friends at the bars and the wineries were the first to kind of stop. Is it safe to assume they'll also be the last to be told that they can open, operate, or are there ideas that there are guidelines that may be able to be put in place that would open them around the same time as others?
Yeah, so, the Wine Country Alliance and some of our wine partners here in our community have really, it's getting to be a little bit overused phrase these days, but have really leaned in as far as offering solutions that would allow wine tasting to reopen in our community. We've read through those. Many of them make a lot of sense to us. So there is a chance that some of those activities could happen, maybe not on the scale that people would like, but certainly there is an opportunity that we can see where wine tasting could happen and some other things like that. Exactly when, again, I'm not gonna suggest when that could happen. It would be under the broader governor's allowances, but certainly we can see some mechanisms to try and make that happen.
Yeah, and I think it's, again, understanding from the governor's side, he's looking at a state, well, a nation almost, in terms of creating rules that have to apply to Napa, to the Riverside, to San Diego, all these counties, not just SLO. And then obviously that's why we hope, I know that's why the county is making the argument that we're a little different and should be able to kind of do our own thing. So hopefully those things will come to fruition soon. Some folks were mentioning the Mid-State Fair. I don't think either of you are on the board. And a lot of the fairs around have been canceled, but the Mid-State Fair hasn't canceled yet. Any thoughts on this, or do you think they're doing what most are doing, waiting to see the timing of how all of this kind of moves?
It's not a topic I've been following closely, so I wouldn't want to comment on that one.
Yeah, I'd say, Jim, you probably all saw the announcement by downtown SLO with the cancellation of the summer concert series. You know, I know that Bettina and the board, I'm sure they took that, you know, very serious decision, but ultimately, just given that, you know, traditionally, you know, that series starts here very soon, and just seeing where we're at in our different phases, it just didn't make a lot of sense. And I appreciate, you know, their cooperation and communication with everyone. You know, these are just kind of the really tough decisions that, at least in that instance, that they had to make for what was in the best public health interest of our community. And I think we're going to have to continue to be nimble and flexible and agile as we work through this, and understand that, you know, some things that we may be counting on just may be uncertain right up until the last minute.
Yeah, it's definitely a time where being nimble and flexible, you know, for all of our organizations are, you know, there are very few definites right now. So I appreciate that comment, Eric. That's fabulous. So this goes to a question. Let's just talk, and I know it's an ongoing discussions, but if you could talk about a little, is enforcement. When we're talking about a best practice guideline, Guy, you talked about that a little earlier, getting people to comply with those best practice guidelines. Is there someone specifically who would be in charge of that? Are those ongoing conversations to determine who would be responsible? Or, like I think the governor said today, that he's sending ATF to bars. Is it dependent on who's in control? I'd love to get your thoughts on that.
So certainly welcome Derek to weigh in on this one as well. You know, enforcement, I think, as Derek described earlier, is best done by, you know, just having a conversation with someone and saying, hey, you understand that this really isn't allowed. And even I think the governor used a statistic of some 82 industry or bar kind of organizations he sent people out to. And in 81 cases, it was a simple conversation, and the activity returned to where it should have been. I don't know what the other outcome was in that 82nd case, but you know, certainly where you have things like licensure at the state level, that's a lever that the governor sounds like he might be willing to pull, should he need to. We've seen that same conversation in the hair salon industry, where the cosmetology industry is licensed by the state, and they've said they will consider pulling the license of hair salon operators if they're operating in violation of the state law, or state order rather. So, you know, apart from that, I think we'd rather focus on the fact that, you know, this is San Luis Obispo County. We've got wonderful 7 cities and our partners in Santa Maria. And, you know, let's just have the conversation and hope that folks can pull back voluntarily, and we don't have to go down the full compliance, heavy-handed approach.
Yeah, and I'll just echo, you know, we're taking kind of approach of, you know, educate, outreach, help people understand the guidelines. We'll try to make them as common sense as possible. I know that that's hard, because some of this isn't necessarily common sense. Some of it has roots in deep-seated public health and epidemiology, and so it may not be as readily understandable. But I do trust that, you know, I mean, if you've spent a lot of time like myself reading about, you know, the field of public health in the last 6 weeks, you know that people have spent, you know, decades thinking about this moment in our nation's history, and thinking about the real challenges of communicating. And these people are true public servants and trying to figure out guidelines that work best to really stop the infection. Because ultimately, I think, Jim, as you pointed out, stopping and slowing the infection is ultimately what's going to be best for our economy. What we want to set up in the city when we are given the green light by the state and by the county is a concierge level of service, meaning we're not going to redirect, but we're going to answer questions. And so you'll have someone who will be there to answer questions and track and be dogged in getting the answer, because we know that many of the businesses have businesses to run, to get back up on their feet. And so we want to be there to do our work and help them get back going. I shared with you some of the information that we have our phone lines. We'll have a web portal to ask questions in which we'll be getting back to folks in a very timely way. And I will say, just to answer your question directly, you know, under the extreme circumstances, if there are individuals and scofflaws who simply are just disobeying the rules, we can take enforcement action. We don't want to, but we will ultimately if it comes to a situation where it is a clear, you know, and dangerous threat to public health.
Yeah, thank you. And it's, yeah, again, we appreciate that you're both taking that idea of working with folks because, again, same, you know, making sure people understand the rules before we come down hard, especially in this time. But then, Derek, certainly appreciate the other piece where some are just flaunting it directly. That isn't good for any of us. So
our region, we can't afford to go backwards. We can't. There's been, if you think about the last 8 weeks and all the sacrifices, and to have individuals or businesses simply just ignore the rules for whatever reason and to the great detriment of the community, you know, those are the types of instances where I think collectively we will get the necessary resolve to take whatever action is appropriate.
Right. I keep getting questions on the timeline. I know there's no way to predict the timeline, but I think the governor and his medical staff today started to deliver some statistics of what will potentially trigger those things. It is the first time I've seen them. I'm not sure if that's the first time they've really been released overall, but is that really the determinant of the timeline when we start to see this caseload of new cases going this way, our occupancy at our hospitals, et cetera? Guy, do you have some thoughts on that?
On which part of that, Jim? There was a lot in there.
So in the piece of since we don't know a timeline, because it all depends on when he's going to transfer authority, and then in the start guide also, the triggers are statistics.
Sure.
Are those statistics the state put out today likely to be the ones that kind of translate all the way down, or will the county, or will Dr. Bornstein and her panel come up with other ones that potentially would trigger all the rest of our operations?
Jim, I think I'd refer you back to Derek's answer of a few minutes ago on a different topic slightly. And that is, remember, our start guide was built and it considered a couple of three things, right? Importantly, that we're a tourist destination from, you know, our surrounding communities, from the Central Valley and north and south of us. It considers the fact that we're a thoroughfare between LA and San Francisco, right? Two areas that have seen high numbers, and that we have a university, right? And so we do take into consideration when we consider what might allow us to move forward or what might cause us to move backward in a reopening kind of view. We do consider those things as part of our statistics as well. Now, certainly, much like the other answers about rules and guidelines from the state, you know, if the governor puts out some sort of guidelines, we'll look at those really closely and then try and understand how they apply to us here locally.
Okay, yeah, that's fair. Wearing face mask in the restaurant for workers is still mandatory. Is that a specific one to get back to folks on, or is it mandatory to? I know that I saw in Pismo they were having a conversation about that just in generally in public, but I wasn't sure about the restaurant workers needing a mask specifically.
I think this speaks to kind of the broader conversation around face coverings and masks. You know, I think we've all heard Dr. Penny talk on a couple of occasions. She's put out some really good clips, and I would encourage anybody to go listen to those about the pros and cons of wearing face coverings. You know, done right, they do protect others. If you don't wear them and care for them correctly, you know, it can actually increase the risk in some cases. So there's this real kind of tear between when you should wear them, when you shouldn't wear them, who should wear them, who shouldn't wear them. But clearly, you know, following her general guidelines that, you know, if you can't maintain that 6 foot of physical distancing, a best practice is to wear face coverings to protect the person who's within 6 feet of you.
And that's, it goes actually spot on to the next question, which is, does the county have plans to make wearing masks mandatory at this time? You put that in there.
Yeah, not at this time. We don't have any such thing even agendized for the board or for Dr. Borenstein based on what she said. Not at this time. Yeah, definitely not.
And Jim, we do have an item that's up for discussion tomorrow at our disaster council. So our council has received a fair amount of input, of course, and we're going to provide the information. Dr. Borenstein has prepared a white paper that we're going to share with the city council to help inform them on at least our public health officials' perspective on it. And we'll see ultimately where the city council wants to go. We have done a great job having a unified approach between the county and the cities. My understanding is Pismo earlier this week the city of Pismo did introduce a face mask requirement as a regular ordinance. And so if it's adopted at second reading, it wouldn't take effect until mid-June. Grover Beach is currently evaluating face mask requirements. They'll be taking, their city council will be evaluating that item, I believe, on the 19th of May. So, just the mixed opinions out there, I think are giving city councils and they're wanting to take a look at it and specifically for their communities and figure out what's appropriate.
Absolutely. Yeah, that's and it's been our view as we've been watching it go around to have those discussions. So appreciate you letting us know about Friday for folks who want to have input on that. I think, Guy, and as our last question, which is an interesting one, again, going back out to the crystal ball, but I'm wondering if conversations have already started about the plans for the general election on November 3rd. Yeah, that's actually a great question and an interesting one. And I know there's a lot of people concerned on both sides, on all sides on this one, of how that might work. Any thoughts or any preliminary conversations about that?
Yeah, there are quite a bit of conversations about the general election going on in Sacramento right now. A bill was introduced late last week. I think it passed through the assembly yesterday and is on to the Senate either today or tomorrow. There is a lot of discussion about what that would look like. It won't be our typical polling places, but there's discussion about as many as 20 larger, more well-equipped polling places throughout the county. Early conversations had that number at a lot smaller number, maybe around 10, but it looks like it'll be 20. So we expect a lot of vote by mail, right? Will be occurring, but for those folks who want to go into a polling place, there'll be, it looks like 20 of them spread throughout the county. I think that the rest of that question probably had a little bit to do with, well, who's going to provide PPE for those folks, right? Certainly the county would provide it for the poll workers. Voters that were trying to come in would be encouraged to if they wanted to bring their own face covering and wear their own face covering. But hopefully we can do it in such a way that, people don't have to be put very close to each other. Since once we know the exact count, if it is indeed 20, we'll be looking for 20 locations that allow us to spread people out as far as possible.
Excellent. Well, I want to thank you both for joining us today. Derek and Guy, I know you guys are so busy right now. Throughout this crisis, you guys have been there. So thank you so much on behalf of all of us that are here today. We hope this important conversation helped shed some light on our county's reopening and potentially how to plan for this future happening and where to look for information. A recording of the webinar will be available immediately on our Facebook page and on our website and other social media channels soon. Additionally, we will be sending a recap email to registrants with the Q&A text, along with the city slide deck and a copy of the recording. So we'll see everybody next week on Thursday at 2 p.m. for our weekly webinar. We thank everyone for joining us and just make sure to stay healthy and well out there. Thank you all.
Thank you, Jim.